Another movement is like this, like a circle. And guess what this was named? Circumduction. So we have circumduction at the shoulder joint. We can have circumduction at the hip joint. We have circumduction in the metacarpophalangeal joint. If we are rotating something in an axis, that's not circumduction, okay? So look at this. This is the imaginary line. What I am doing is I am moving my head laterally. This is called lateral rotation, okay? Look at my hip now. If I move my lower limb like this, look at my foot. When I did this movement, I rotate my lower limb externally. And this is called external rotation at the hip joint. Also called lateral rotation at the hip joint, because I rotated my lower limb laterally. Now let's go back to the anatomical position. If I move my lower limb like this, and I bring it closer to the midline, we then have a medial rotation at the hip joint, also called internal rotation at the hip joint, because it moved internally, so the inside of the body. We can also have this movement at the shoulder joint, right? And for you to be able to sit better, I will flex at the elbow. Now, I can move my upper limb laterally, so this is lateral rotation at the shoulder joint. And I can also move my upper limb medially, bring it closer to the midline. And this is medial rotation at the shoulder joint, also called internal rotation at the shoulder joint. And this is external rotation at the shoulder joint.